Coming up on NPT Reports, COVID-19 Beyond Numbers. We'll discuss the coronavirus pandemic in Tennessee. Our state ranks in the U.S. top 10 for total cases since March. Now, coronavirus is surging again in numbers higher than ever. By mid-November, the Tennessee Department of Health reported more than 300,000 cases statewide and more than 4,000 deaths. New cases number well into the thousands each day. Of the top 10 counties with the highest number of coronavirus cases, most are in Middle Tennessee. The battle of the virus is impacting all areas of medical care in our community, directly or indirectly.
COVID-19 has also shone a light on things that we don't necessarily chat about. I have had more discussions about anxiety. So no problem. So we'll figure out what's the best step for you so that we get you relief.
The pandemic has opened wounds created by America's healthcare disparities due to race and socioeconomics.
I've seen people have worse outcomes because they can't get to the specialist they need to get to, or inability to get into the doctor's office when they need to. I've seen people that don't necessarily have the education or the wherewithal to know where to go and maneuver the system.
How is this pandemic affecting local healthcare services and access? Which communities are most impacted? What are the ongoing challenges for all of us until there is a vaccine or cure? Joining me for the next half hour to discuss these issues are Dr. Alex Jahangir, Chair of the Metro Nashville Coronavirus Task Force and an orthopedic surgeon; J.C. Worrell, Executive Director of the Rural Health Association of Middle Tennessee; Dr. Ima Ahankai, an infectious disease specialist at Vanderbilt University Medical Center; and Christy DeGallery, a coronavirus survivor who started an online support group for Black COVID-19 survivors. Hello, and thanks to each of you for joining this discussion. And for our viewers who are watching at home, as you can see, we are all speaking remotely in the interest of protecting our own safety and health during this pandemic. Dr. Jahangir, I'd like to start with you because you are the head of the task force. So in some ways, Nashville-Davidson County is sort of like your patient when it comes to coronavirus. What is our prognosis? How are we doing right now in this community?
Sure, thank you. And that's actually a really great analogy for it and how I approached this. So, Nashville right now is we're, the patient's getting a little sicker. Okay, so to put in perspective, our first case in Nashville happened on March 7th. And we quickly, as the summer progressed, we're the worst county in our entire state for disease activity. We were the first to instill the safer at home orders. We were the first to put in place the mask mandates in the summer. And quickly we became much better for COVID activity in the state. In fact, today, although our numbers are high and all over the country and the state our numbers are high, we're no longer the worst county in the state. In fact, we're 43rd out of 95 counties for disease activity. So the patient has gotten stable, if you will, but we're still a little touch and go. Fast forward now, and what we're seeing today, actually, right before we got on, we have just shy of 300 people in our area hospitals. Over a third of those people now are from rural areas because Nashville is such a big regional medical center hub. A lot of people are coming from outside our counties. Furthermore, these are now older people, and most of the people receive the disease now from close contacts, from family members. And that right there is one of the biggest concerns that I have going forward, and why I think I use this term, we're stable, but I'm still it's very touch and go. So we'll see.
Okay. I want to pick up on something you mentioned about many of the patients you're seeing now being from rural areas. JC, I'd love to get you to weigh in because, I think early on, and even now, some people think, okay, rural areas, we call it the country. It's wide open spaces. People live far apart, tend to assume that people live healthier and maybe aren't at risk for coronavirus. At least that may be the assumption. What we're hearing from Dr. Jahangir contradicts that. What are you seeing?
Exactly what he is saying. We're very concerned about the spread of COVID in rural areas. I can't tell you how many times I talked to someone in a rural area that said this is an urban issue. And that was probably true at the start of the pandemic. So when it very first showed up in some of our other areas, our rural communities were lagging. And so our biggest concern was as the COVID cases spiked in the urban areas was that, and then start to go down and everybody think that they were safer now, that's when it would start increasing in the rural areas. And we've seen a little bit of that, although it is concerning all around. We're seeing factories are having to close, schools are having trouble getting substitute teachers because a lot of times the substitute teachers in rural communities are older and they're more concerned about getting COVID. We're seeing more outbreaks in churches and assisted living facilities. And like the doctor said, this is all having an impact, not just on the rural communities, but the metro areas that are supporting the metro population, but also the surrounding rural communities. So we're definitely seeing the ripple effect and how it's impacting the entire state.
You know, I guess in some ways, coronavirus is kind of the great equalizer. I mean, and we're all everywhere kind of struggling to figure it all out. But are there more challenges, do you think, in rural areas among your member organizations?
There are definitely unique challenges to the rural community. So we know as a general rule, the rural communities are higher poverty rates. They tend to be less healthy. Your older population predominantly resides in the rural areas, and we know that those people are more susceptible to the adverse effects of COVID. And then just from a population health standpoint, we know that Tennessee, unfortunately, usually ranks in the bottom of all of our health outcome measures, whether it's diabetes or chronic disease. And so all of those pre-existing conditions that are more prevalent in rural communities also means that they're at greater risk.
Okay. Dr. Ahankai, I want to bring you into the conversation. Much of your work has been centered around HIV and AIDS, of course, another pandemic that was very devastating a few years ago, but we've learned a lot about it. And I'm wondering how much you and your colleagues have learned about coronavirus, because I know the information as lay people that we get has changed quite a bit since those early days.
Yeah, those are great questions. So, I mean, I think there's some interesting parallels in just thinking about the AIDS epidemic when it first kind of hit the scene in the late 80s and what's happening with coronavirus, with SARS-CoV-2. And, you know, just with the idea of the kind of complete disbelief initially, a lot of fear and kind of in the messaging and misunderstanding of what's happening. And then kind of seeing some of the worst characteristics come out in society as people are kind of really focused on self-preservation and making sure they and their families, before kind of seeing more rallying and support around communities. And I think we've seen all of those things happening. But the scale is just inordinate. You know, there are 38 million people living with HIV in the world now, and COVID's well surpassed that in terms of the number of infections. But the pace of discovery has been inordinate. I don't think we've ever seen anything like this in the medical community. The data comes out, you know, daily. You know, those of us who do research on other things, it's even difficult to get research published because journals are really focused on getting information out there to the public. I think it's clear now how SARS-CoV-2 is transmitted through droplet spread and less so via airborne, but that's also a possibility. We know that we have to utilize social distancing to prevent transmission, and that 6 feet is the distance that has been studied, because we know that droplet transmission is less likely if you're beyond 6 feet. We know that mask wearing reduces substantially the risk of transmission, and we know that we need to stop gathering in large numbers. So those are very basic things, but also very difficult things that we've begun to understand about transmission.
Christy, it's so good to have your perspective as part of this discussion, as someone who's actually survived COVID, and you now have started a support group for others. Tell us a little bit about your experiences early on when you were diagnosed. How were you diagnosed? What were your symptoms? What was it like living with the pandemic?
I was actually a mile away from a hot zone in New York. It was early on, it was March, when everyone was, figuring out what was going on. And I was kind of, skeptical. I was like, there's no way this is like happening, or this is going to even happen to me. But it happened late in March, and I started having what I thought was heartburn. And it lasted for about 3 days, and it became really intense. So I looked up the symptoms, and I was like, okay, chest pain is one of them. Let me be sure. I went to a testing site in my neighborhood, and I found out about 5 days later. And waiting those 5 days, I immediately knew, because other symptoms started to happening. My legs were hurting. I could barely see. A lot was happening, and I got that initial call from my health department, and notified everyone. At that time, I was already self-isolating. Notified my family, let everyone know that was around me during that time, and luckily, everyone that was around the week before did not test positive. But I had it till about the end of May. And, again, in the beginning, everyone was figuring out what was happening. So I thought it was going to be 14 days and I'd be fine. But it got worse, and I got pneumonia, and it was really scary. And during that time, I felt, outside of being isolated and quarantined, I felt really alone with my symptoms. So I went to find some support groups, and I did really quickly. And I was in one, but still in the support group, I really didn't feel, seen. As I started immediately noticing the racial disparities within the group.
And what were you noticing? You were noticing that your symptoms weren't relatable?
My white counterparts in the group would say that they got medication for pain, or they got x-rays to look at their lungs, and all these things that were provided for them. And I was like, I was just told to go home and take Tylenol. I didn't, get this feedback that all of you were getting. And it kind of raised this flag in my mind, and I was like, okay, I know what's happening. And I'm sure throughout my life, the racial biases in the medical field, they're there, and I've probably experienced them so many times and didn't realize. But I think in the first time in my life, it was such a severe moment for me of being sick that it stood out. And I started the support group in a Slack app, and now we have about 3,000 people, and all of them are Black and POC. And many of the people in there are people that have lost people that are, still have it. And it's been this really important space and safe space for people that finally can be like, okay, I'm not crazy. I was waiting in the emergency room for a very long time. That person did go before me. I didn't get that x-ray, even though I asked over and over again. And just realizing that, it wasn't our fault that bad things happened to us, and that there is a real problem in the medical field in this country, and that racial bias exists. So I think that was a awakening for all of us.
Thank you for sharing your story. I think that's what a great thing you've done. Health disparities in this country is not something that just came about in the past few years, right? I mean, for 400+ years, health disparities have been a reality. And so when COVID came into our city, what we realized really quickly is this health disparities issue was just going to be expanded that much more and highlighted that much more quickly. And it was, right? Early on, our biggest population of individuals that got this disease were mainly our immigrant population and mainly Latinx individuals. And I think that came from where they live, their work conditions, their ability to not self-isolate, the lack of housing and food security. And so we tried to address this as a city in a way, and we had some successes and failures. So I want to start out by acknowledging that, is we set up our testing centers in locations in which people who were less likely to have access to healthcare had access to it. All right, so we put testing centers in Southeast, in Antioch, where a lot of our immigrant population lives, and near Meharry Medical College or Nissan Stadium, places where people can come to. And I'm proud to say we've offered over 250,000 free tests right now in our community systems. We also partnered with people who had already earned the trust of the communities, right? So whether it's partnering with Meharry Medical College or partnering with groups such as Conexión America and Turks to help get into, to build that trust in the communities, our immigrant population is really critical. With all that said, though, African Americans in Nashville, as a percentage of total African Americans, there's less African Americans who are infected in Nashville. The mortality rate is maybe 2 times or maybe 3 times for those individuals who are African Americans who have received the virus in Nashville. Okay, so as a community, they may be doing better at not getting the disease, but when they get it, they're so much worse off. And then the corollary to that is our immigrant populations are getting it much more as a percentage of their population in Nashville. But because they tend to be younger and probably a little bit healthier, they're not dying as worse. So this virus just highlights the health disparities that we have in our city, in our state, in our country.
Is this an awakening, maybe, when it comes to policy and resources that I'm sure folks like you have been for years trying to bring attention to when it comes to disparities?
Not only has there been an awakening, but part of the issue is that nobody can look away. I mean, part of this time we've been confined in our homes. Everyone is seeing the same headlines. And there isn't one chronic disease where we can't point to these disparities, racial and ethnic disparities in either disease prevalence or disease outcomes. Not because there's something wrong with you as an individual because of your race, but really making sure we get to addressing all of those structural determinants of health. I hope this is an awakening that we stay vigilant about, because on the horizon we have vaccine candidate that already looks very promising. We have to figure out how to deliver that in an equitable manner. We have to make sure that once COVID is under control, that we don't forget the disparities that are still there and make changes that will be lasting.
I like to remind people that the number one predictor of health is your zip code. And that is true whether you're in an urban area or a rural area. And so oftentimes we tend to talk about urban in one hand and rural in another hand, but we know that we can look at any zip code in the country and based on a very number of factors, know the general health of that population. I also like to remind people that rural America, rural Tennessee is not synonymous with white Tennessee. We do have populations of color in rural communities, and I think that's important to remember also. And then when you have kind of these multiple risk factors, that's when we see the disparities become even wider.
Christy, what is the main, one or two concerns that your members in the support group have at this point as we head into a period where numbers are surging and, we're in transition with leadership and policies and that sort of thing?
Emotionally, I think a lot of people are concerned about what's going to happen to them. Those that are sick, those that have lost people, those that have recovered and survived. It just, I think, mentally has taken a toll on a lot of us. And I think right now, a lot of the people in the group are concerned about money. Honestly, a lot of like the majority of everyone in that group is unemployed, have completely lost their jobs, and are worried about what's going to happen next for them. If they can get out of this funk, whether it is emotionally or if it's just, the physical part of it. And are things really going to change for them in the future? When that comes to if they have to go to the hospital again, as a lot of them are just kind of discouraged to even go into a emergency room or to get checked out because of the fear that they may not be believed, that they are still having maybe symptoms even though they look okay.
Dr. Jahangir, she raises some very interesting points about we still don't really know where the bottom is in some ways for people who have this disease or this virus.
I think you're right. I mean, I think this disease has only really been around for 8 months in the United States, right? Maybe 9 months. And we don't know what the long-term implications are. Like the long haulers, as some are called, people who've had this disease for many months or longer, we don't know what the long-term sequelae are, right? Their studies have now shown professional level athletes who get it, who have heart conditions that now prevent them from doing anything. And I think that right there is why it really concerns me when you hear people, especially younger people, blow this off and say, whatever, I'm just going to get it. It's fine. It's not fine. This virus, we don't know everything that it can do to you. A national plan should consider how do we give people access to healthcare and not make this a pre-existing condition that prohibits you from getting healthcare, because we don't know what's going to happen a year from now for some individuals that have this virus and who have recovered as we're defining it. So I think that's a really critical component as well.
As we get ready to wrap up this discussion, as the numbers are constantly rising right now to levels higher than we saw in the early days, and there are a lot of ominous reports about what to expect as we head into a period of the holiday season when there's usually a lot of socialization and gatherings. What are your concerns and what is your advice?
We don't want people to live in fear. There is a concern of the mental health impact that this has had on a lot of people. And we do want people to be smart about the way that they interact. So I can just share for me personally, I want to go visit my sister over the Thanksgiving holiday. So leading up 2 weeks beforehand, I'm going to be extra careful. I have to take the COVID test and 3 days before I fly to go see her. But that's something that I want to do because I want to be able to travel to see my sister and I want to spend time with her. So I definitely think that people just need to practice the distancing. I don't like to say social distancing, so it's a physical distancing. We still want people to have those connections.
I'm concerned that my support group's going to continue to get bigger, which in reality, it's great that they are finding support, but it's also devastating that it's getting bigger. I want them to know that they aren't alone, and that where they see a lack of support in hospitals and their local communities, that there are people that want them to fight this and want them to stay afloat and not be discouraged, even though their surroundings and where they live may be a discouraging place for them at the moment. And that hopefully that's all we can have is just hope that we can all get out of this in a way that's just safe for everyone.
I think the fact that we have some promising vaccine candidates on the horizon is so encouraging because it gives us something to look forward to when the future timeline seemed really uncertain. At least that's something to really hold on to now, and encourage people that, we should really try and make it through to that timeline, really practicing these guidelines. I like what JC said, physical distancing, but not social distancing. But heading into the holidays with numbers higher than we've ever seen before in this country, we will need to make some sacrifices. And I think people need to really think critically about how they're gathering for the holidays and realize that we will need to make sacrifices to keep our loved ones safe during this holiday season. And it's a sacrifice that I know that I will make. I have elderly parents. My kids are in school, as many of us are, and the numbers are climbing in the schools as well. And I can't risk my parents being exposed either for my children or myself and my husband, who are both in the medical field. So we will be celebrating virtually and trying to find fun ways to mark the holidays, and we'll just have to be very creative.
I think a lot of people are in that same boat. Dr. Jahangir, what would you like to say to people about the next few weeks?
I think my colleagues have really summarized it well, but I think the biggest worry I have is complacency. We now hopefully see a finish line, 2-3 months. 4 months. I don't know, but it's there. Where before it was just an abyss. But that's like we're running a marathon and we're at mile 15 and we're gonna slow down and walk and not take our nutrients and so forth. You're not gonna hit the finish line. So complacency is what I worry most about. We're all tired of this. We're all physically and mentally drained. I mean, I'm no exception. But let's just stick through it. Wear our masks. Make some of these sacrifices. I'm sacrificing for the Thanksgiving holiday as well, right? I mean, from family traditions. But is it really a sacrifice if you can have 30 more afterwards because you did what you need to do right now?
Well, thank you all, and it's good to be reminded of not being complacent and to continue to be diligent. But there is light at the end of the tunnel. There's hope, and we just all have to do our part. To our viewers, if you would like to get more information, we'll have that on our website, wnpt.org. Thank you very much, and be safe.